Rollins with EHRtv. I'm at HIMSS 2012 in Las Vegas, and I have the pleasure today of speaking to Mr. Steven Ferguson, who's the Patient Management Officer for Hello Health. Steven, thanks for joining us today.
My pleasure.
So here we are at HIMSS. I understand there's some exciting rollout happening right now. Could you tell me a little about it?
Sure. There's a lot of buzz here about Qualcomm Life and their 2net product. It's an interesting device because what they've done is they've realized that there's going to be a weakness in the wireless device market because all these devices transmit their signals via different radio wavelengths. And so within one device now, they're able to grab all that information and do something useful with it.
So tell me how that translates to real life.
So in a real life setting, what vendors of devices will be able to do, and when I say devices, I mean monitoring devices like a blood pressure monitor, a glucometer,
in the home,
weight scale, in the home. Could be in the clinic, but I see a lot of application for the home. People will be able to take this device home, plug it into any outlet, and this device will transmit the data from their monitoring device, put that in the cloud, and then it can be grabbed from the cloud and displayed to them in a portal or in some sort of safe, secure way they can go ahead and access this online.
So if the person has multiple devices that are made by different companies, this can all bring it together and put it to the cloud.
Absolutely.
Is that what you're saying?
Actually, that's the point. So the minute you have more than one monitor from more than one company, you end up going to two different places to see that disparate information. But this way it becomes aggregated and can be presented to you in one spot. And you've got one device that captures the data from both devices or more than that.
So to clarify for me, 2net is actually a Qualcomm product.
It is.
And Hello Health's contribution to that product is?
We're a software company. We have an offering for small physician practices. We've been working with Qualcomm for a while now, and so what we've done with 2net and Qualcomm Life is developed a front end that takes that data from those different devices and displays it in one dashboard. So we've built a sensor dashboard, which you see here behind me.
I see. Can you speak a little about security? Is it encrypted?
That is encrypted, so there's no security issues there. It's the same level of encryption that you'd find at your banking website, for example.
I see. Now, how will this impact the physician? What do you think, how is this going to be received?
That's an interesting question. I think I see some unique applications up front in like corporate settings, for example. Companies that self-insure are looking at ways of avoiding cost, and if you can distribute these devices to their workforce and then realize gains because you get a healthier workforce because of it, I think you'll see physicians related to those types of groups happy to be working with that data. For small independent physicians, I think we'll have to start by introducing this to the patients, getting the patients used to it, giving patients access to it, and then finding a model where it makes sense for the physicians to also see that data and take action and help guide the patients.
So there are a few challenges, but it doesn't sound like anything that's insurmountable.
No, like anything, I think that we'll go through a bit of a learning curve to figure out how to best deploy this and wrap a business model around it, but we'll definitely get there. There are some doctors that are definitely excited about this sort of technology.
Now, Hello Health has a core business. This is not it. Tell me a little about Hello Health.
So the Hello Health business is that we provide a suite of software tools and services to small physician practices. Most of our practices today in the primary care space, but it's a bit of a different model in that it's a patient subscription model that drives revenue for the physician and revenue for Hello Health. So
elaborate on that.
Right. So small physician practice has been a hard nut to crack. They're one doctor, two doctor shops. They're really small independent businesses. And so what they're looking for is a partner, not necessarily a vendor. And Hello Health goes to these practices and partners with them in that we help them get online with the technology, train them, implementation. It doesn't cost the practice anything. The practice starts to use it, and data gets put into the EMR. There's a patient portal now where patients can go and have access to communications tools, lab results, prescription renewal, and there's a value attached to that. And so for a small annual fee, patients will pay to have access to the premium service, and that's what drives the model for both the practice and for us.
Are you live with this model?
Yeah, we've
currently?
got a couple of dozen sites live today, and a nice backlog growing as well.
Very interesting. Well, I'd like to thank you for spending time talking to me. It was a pleasure meeting you.
Thank you.
Howard Rollins for EHRtv, Steven Ferguson, thank you very much.